We've approved 36 tests to date, including 2 that are point of care that can help with rapid testing in specific populations like rural and remote communities. To date, we have not received any home test kits for review, but we're actively engaging with companies that produce these types of tests to encourage them to apply here in Canada. And when they apply, we will be ready. We have doubled our people, and we've sped up our processes to review tests and grant decisions quickly within 40 days of an application. The world is seized with COVID-19, and researchers and scientists are working day and night to work on new tools that will better track and treat this illness. As we learn to live with COVID-19, testing will continue to be a key part of our public health approach. And will continue to be there for provinces and territories and regions that are struggling with outbreaks of COVID-19, including mobilizing federal testing surge capacity to help them with those needs. But we can't underestimate the power of our own behavior. The most effective public health measures continue to be washing our hands, physical distancing, wearing a mask, and socializing less. I also implore people who are not feeling well to stay at home when they're sick and to reach out to local public health for advice. COVID-19 is taking a toll on all of us. It is hard to stay apart, especially when others are reaching out. But it is an act of love. We can protect each other, we can flatten the curve again, and we can save lives. Merci.
Merci beaucoup, Patty. Dr. Tam.
Thank you very much.
Good
Patty.
afternoon and bonjour à toutes et tous.
Good day, everyone.
There have been 155,301 cases of COVID-19 in Canada, including 9,278 deaths. Labs across Canada tested an average of over 71,000 people daily over the past week, with a 1.7% testing positive. Yesterday, a total of 2,176 cases were reported nationally. 437 of these were backlogged cases from the weekend, and 1,739 were newly identified yesterday. This means daily case counts has now reached the peak of daily cases seen in April, and the average daily case count has increased to 1,412 cases being reported during the most recent 7 days. The fact that cases are now at the same level as during the initial peak is worrisome. At the same time, there are clear differences in the epidemiology, with younger age groups predominating among cases, and we are testing and detecting more. Things have escalated quickly, and they can escalate further unless we all work together to slow the spread of the virus. There is no doubt that testing, tracing, and isolating in order to interrupt transmission of the virus and prevent further infections is a cornerstone of our pandemic response. Public health authorities are working hard to find a range of testing solutions to improve access and speed up the turnaround time for results. In Ontario, for example, as in Alberta, tests can now be performed in pharmacies. British Columbia has introduced a spit and swish testing method, which will be used as an alternative to the nasal swab, especially for collecting samples from children. Health Canada is reviewing a range of simpler to use and faster tests. As the regulator, Health Canada is responsible for ensuring the safety, effectiveness, and quality of all tests, which is crucial for disease management. For example, an underperforming test could result in a high number of false negative results, where people think they aren't infected when they are, leading to unintentional exposures. This is why the review process is so important and why no corners can be cut. As the number of cases rise and the demand for testing increases, testing will be most important for those who have COVID-19 symptoms, have been exposed to a confirmed case, or are part of an outbreak investigation, or have been otherwise advised by local public health to get tested. As I have said before, getting tested for COVID-19 is an act of kindness that can protect you, your family, and your community. I also wanted to mention a new online tool called COVID Trends, released by the Public Health Agency of Canada. It provides you with the number of confirmed COVID-19 cases in your area within the last 14 days. This is another way to stay informed about COVID-19 activities in your community and help you make informed decisions to keep yourself and your family safer. And as always, I want to end by asking everyone to follow the public health practices we know to be effective, including physical distancing, frequent hand washing, and wearing a non-medical mask in closed spaces, crowded places, and close contact situations where distancing is difficult. Most importantly, stay home and self-isolate if you have symptoms, even mild ones. Thank you.